Ms. Michelle, fellow panelists, distinguished colleagues, and a special welcome to the youngest members of the audience, the babies in the audience that are with us today, that have survived the neonatal period and are growing and thriving well. I'm delighted to be here with you today on behalf of WHO, and thank you to the rest of the panelists, because the advantage of speaking last is that most of the important points have already been made. So let me wholeheartedly endorse what my fellow panelists have said and just add 3 points. None of these will come to you as a surprise, but that does not make them any less important. All will be key to the success of the Global Newborn Action Plan we are to discuss later today and will be working on throughout the conference. First, we need political will. Second, we do not need to reinvent any wheels. We know what works and we know what to do. And thirdly, we must focus on integration. This means adhering to the continuum of care approach and linking efforts to improve newborn survival with wider movement cascading out of the global strategy on women's and children's health. Firstly, on political will. As we heard from the Minister yesterday, as we've heard from Ms. Michelle and our panelists, one reason why 3 million newborn babies die each year is a lack of attention to newborn survival at all levels. Newborn babies and stillbirths sadly have been left behind despite all the progress made on child survival over the last 10 years. It is indeed 10 years since the launch of the first child survival series in The Lancet. Much attention has been taken for many of the other causes of under 5 mortality, and it is now time to take that attention for newborns. And the good news is that this is changing. You may be aware that 2 years ago, the World Health Assembly passed a resolution on the reduction of perinatal and neonatal mortality. The resolution recognized that slow progress on reducing neonatal mortality is a major impediment to achieving MDG 4. With less than 1,000 days to the MDG deadline, it is time to make that resolution, to take it forward, and to build on the momentum that inspired the governments to agree on it. Secondly, as other speakers have said, many of these babies' lives can be saved, and they can be saved using relatively low technology and low-cost solutions. We know what works. We know it doesn't need to break the bank. And we know it can happen because countries are doing it already. And we will hear these experiences in the meeting throughout this week. The key, though, is to scale up fast. Our task this week is to agree on how to do it. We know to concentrate on the 24 hours around labor, birth, and the early newborn period, that this can be the most precarious time, both for our mothers and for the children. Historically, maternal and child health policy and programs tended to address the mother and the child separately. This was bad news for the mother and bad news for their children. In 2005, with the publication of the World Health Report, Make Every Mother and Child Count, however, policymakers and program implementers have increasingly come around to the continuum of care approach to maternal, newborn, and child health. And this is rooted in the need to keep maternal and newborn interventions joined up. What is good for the baby is good for the mother, and what is good for the mother is good for the baby. And importantly, it also prevents many babies being born still. The old siloed focus on mothers and children has therefore given way to drive to integrate care throughout the life course. This means integrating service delivery for mothers and children from pre-pregnancy through to delivery, the immediate postnatal period, and through to childhood. Within this continuum, good home care practices can be as important as quality health services throughout the life course. Families and communities, outpatient services, clinics, and other health facilities all have a role to play. Recognizing the challenges in providing skilled health workers, many countries have increased their intake of midwives, nurses, doctors, and are also training care providers in the community. My last point is about integration and accountability. A new drive to save newborns' lives must be part and parcel of Every Woman, Every Child movement, resulting from the Global Strategy for Women's and Children's Health, and Committing to Child Survival, A Promise Renewed. You've already heard of the Commission on Information and Accountability for Women's and Children's Health and the Commission on Life-Saving Commodities. These also can all play a valuable part in keeping newborn babies alive and healthy. So too can the Global Action Plan for Pneumonia and Diarrhea, which was launched in Geneva, London, and Washington last week. More than 250 organizations have made commitments to Every Woman, Every Child. Many of them are here in this room with us in Johannesburg today. The Independent Expert Review Group, set up as one of the recommendations from the Commission on Information and Accountability, is reporting annually to the Secretary General the progress in meeting these commitments. We must all be accountable, and we must keep our governments and our organizations accountable. We look forward to working with you to prevent stillbirths, to keep more newborn babies alive and healthy, and to help more countries getting closer to MDG 4 and beyond to ending preventable newborn deaths. Thank you.